Now, the United States is working to vaccinate a high percentage of its population against COVID-19 as soon as possible and end the outbreak in that country. Since vaccine distribution began there on the 14th of December, more than 29 million doses have been administered so far, but it's only reaching a fraction of the population at 77.2%. Joining us now is the adjunct professor for the College of Human Services and University Satellite Manager at Wilmington University, Dr. Amanda Oto. And Amanda Oto, you've already been vaccinated. You are an expat, former South African living in the US. So you are indirectly one of the few South Africans to receive the vaccine, except I don't know if it counts for us because it wasn't really received in this country. But we just thought we'd speak to you about your experience, especially being a doctor and, doing work that contributes to the front lines right now.
Yes, thank you. Good morning. Good morning, South Africans. My name is Dr. Amanda Oto. I reside in Vineland, New Jersey. So I am a vice president of the healthcare agency that is based in the state of New Jersey. So what happened was that we got an email from this state website saying that we need to register so that we can get the vaccine. And you have to be a healthcare institution in order to qualify. So since we service senior citizens, our company qualified. So what the whole process takes place within a period of 2 weeks. We got an email response with attachments that needed your health history forms, which will, kind of like notify the state that what are your, allergic reactions and what might be the reactions that you might have. So it was a process that took about 2 weeks. And then last week, Thursday, we got our first jab, and we went to a healthcare center that, is actually designed for, the healthcare agencies to get the vaccine. We went with our staff, and it was just barely a 5-minute process where we are given information about the vaccine, and they tell us the side effects and what to be expected. So after you get the vaccine, there's a 15-minute observation time after the inoculation to ensure that there's no immediate reaction. And then you get a card which has, the date of your second dosage. And our second dosage is February 25th.
Dr.
We
Oto,
got...
Sure.
Yes.
Did you have any particular anxieties before getting the vaccine? What was your headspace in that moment prior?
So for me, I believe in the power of vaccines, and I do my research. So I was actually very excited to get the vaccine. I was not anxious at all. And I just couldn't wait to get the vaccine. And I didn't care about the side effects and, anything, because, we've just been at a standstill. So it was just a vaccine that had been, long overdue. So I had no, anxiety or any, panic attacks about the vaccine. But there were people that knew that actually said that they were not even going to get the vaccine.
What difference would you say the arrival of the vaccine and also the inoculations of yourself and your colleagues, what did that do for the morale of health workers in particular?
So the health workers in the United States are very excited that there's a vaccine, and even in the hospital settings, we have family friends, we have a lot of friends that work in the hospital. And since I work in the university too, we have nursing students, and some of them are master's level students that are already registered nurses. They've been very, very excited about, getting the vaccine. And the hospitals, they actually organize the vaccine process. So my advice is for the South Africans to do their research about the vaccine that they are going to get, which I believe is going to be the AstraZeneca vaccine. And people need to trust the science and have confidence in the vaccine and just disregard the conspiracies that have been spreading in the social media platforms. And because vaccines actually work. We've seen it with the polio and the yellow fever in Africa.
All right, Dr. Amanda Oto, let's leave it there for today. She is the adjunct professor for the College of Human Services and University Satellite Manager at Wilmington University.